Hi everyone, it's Laura. I'm doing my internship at Indian Health Service on an Indian reservation here in northern North Dakota. Everything's been going really good. Seeing lots of patients that I'm following on my own caseload, and I get to sit in on the majority of my field instructors' clients as well, so it's been really good. So for this week, I reviewed the Adverse Childhood Experience Study, and what it did is it surveyed 8,000 people, and the purpose was to assess the long-term impact of abuse and household dysfunction during childhood on the following outcomes in adults. They're looking for disease risk factors, and incidence, quality of life, healthcare utilization, and mortality. This study was kind of a compilation of a bunch of other questionnaires that are already out and being used, such as some surveys from the National Institute of Mental Health and other behavioral risk factor surveys that are already in place. So it took that information and they also did their own study. Part of the study that they did included a health appraisal, and that was done in clinics by a physician. And the appraisals included completion of a standardized medical questionnaire. It required demographic, biopsychosocial information, review of organ systems, previous medical diagnosis, and family history. And there's also a physical exam included with the health appraisal and lab tests. So that's kind of cool that that's offered. I think that was through a Kaiser Hospital in California. The study really looked at 7 different categories of childhood exposure. They looked at psychological abuse, physical abuse, and sexual abuse. They also looked at household dysfunction. They looked for substance abuse, mental illness, if the mother was treated violently, or if there was criminal behavior in the household. Again, that's for the study participants when they were in their childhood. And some of the risk factors that they assessed, they chose 10 of the risk factors that are the leading causes of morbidity and mortality in the United States. They included smoking, severe obesity, physical inactivity, depressed mood, suicide attempts, alcoholism and drug abuse, parenteral drug abuse, and a high lifetime number of sexual partners. They also included some of the leading diseases, and they included a history of ischemic heart disease, including heart attacks, and the use of nitro for chest pains, any cancer, stroke, chronic bronchitis, emphysema, COPD, diabetes, hepatitis, jaundice, and any skeletal fractures. And there was also kind of a question on this study. It was, do you consider your physical health to be excellent, very good, good, fair, or poor? They did this because the answer to this question is strongly predictive of mortality. The results that they got from the study is that the most prevalent of the 7 categories that they studied was substance abuse in the household. And the least prevalent exposure category was criminal behavior in the household. More than half of the respondents experienced one or more than one of the categories, and about 6% reported 4 or more of those adverse childhood experiences. And they found that the relationship between the childhood experiences and health later on in life, they found, and I kind of found this really interesting too, is that both the prevalence and risk increased for smoking, severe obesity, physical activity, depressed mood, and suicide attempts as the number of exposures increased. So if you had a low number of exposures, you were not at risk or not at as much risk for those types of risk factors. So I thought that was pretty cool. And this kind of really struck my curiosity because I have seen a lot of incidences of trauma in a lot of our patients. And a lot of the trauma is, you know, kind of exactly those 7 risk factors. And then we also see a lot of diabetes, high blood pressure, cancer. So it really, you know, the experience that I've had is really kind of following what this study says too. And there were a couple limits on this survey. One is that it's in self-report. So if the experiences took place a long time ago, your memory might not be as good as it was right when it happens. And another one that I thought was kind of interesting, that makes a lot of sense. They followed these people longitudinally too, especially the ones that had really well documented abuse or neglect in their childhood. But they did find that as these people got older, they were it was harder to have a good sample size, and they figured that this was because if you have a lot of adverse experiences in childhood, you're more likely to have a lot of the risk factors such as diabetes, high blood pressure, and they just kind of figured out, you know, people with those type of health conditions don't live as long. So they didn't quite have the number of people they would have liked to follow that long in their life. So I kind of really liked this little study. The article that I did find on the internet, this one is called Relationship of Childhood Abuse and Household Dysfunction to Many of the Leading Causes of Death in Adults. This is the Adverse Childhood Experiences Study, the ACE study. So I just thought I would share that with you. I hope everybody's doing well. Thanks.